Okay, so today we're going to talk about rotator cuff muscles, and let's begin. There are four rotator cuff muscles around our shoulder, and today we will talk about their origin and insertion, their innervation, and their action on the shoulder. So first of all, we're going to talk about the supraspinatus. It is one of the four. So we can see here, number one is representing the supraspinatus, and its origin is from the supraspinous fossa of the scapula. As it is above the spine, this region, so it is named as the supraspinous fossa. So supraspinatus muscle is originating from here, and it is inserting on the greater tubercle of the humerus superiorly here at this part. And its main action is the abduction of the arm at the shoulder joint is taking part in it, and its innervation by the suprascapular nerve, which is coming from the C4 to C6 level. Let's have a look at how it looks in the origin, that supraspinatus muscle. Let's have a look from the lateral view, attaching at the greater tubercle of the humerus superiorly at this spot. Let's go to the second muscle. The second is the infraspinatus, below the spine. Here we can see this region is representing the origin of the infraspinatus muscle. Infraspinatus muscle originating from the infraspinous fossa of the scapula, and it is inserting on the same tubercle, greater tubercle, but a little bit below as compared to the supraspinatus here. Its main action when it contracts the external rotation of the arm, and is innervated by the suprascapular nerve tube. See on the origin that infraspinatus muscle from the infraspinous fossa and inserting on the greater tubercle. See from the lateral view here, the infraspinous muscle attaching on the greater tubercle. Now we are going to the third muscle of the rotator cuff. The number 3 is representing the number third muscle, and that is actually the teres minor. It is originating from the lateral border of the scapula, and it is also inserting on the greater tubercle of the humerus as the above two, but it is the most inferior as compared to the other two. So its main function is the external rotation of the arm and weak adduction. A weak adduction. When it contract, it is performing a little bit adduction too. So its innervation is happening by the axillary nerve from the C5 to C6 level. Let's see that in the muscle. Here we got the teres minor muscle. Let's see from the lateral view. The last muscle of the rotator cuff, subscapularis. Subscapularis muscle, actually we can see behind the rib cage at this place on the scapula. At the subscapular fossa of the scapula, it is originating and inserting on the lesser tubercle of the humerus. And its main function is the internal rotation, and is innervating from the upper and the lower subscapular nerve from the C5 and C6 level. So we can see here the subscapularis, which is originating from the subscapular fossa and inserting on the lesser tubercle of the humerus. Let's see from the lateral view, and in the lateral view we can also see that is inserting on the lesser tubercle. So we are done with our 4 rotator cuff muscles. Let me repeat one more time: supraspinatus, infraspinatus, teres minor, subscapularis. Thank you very much. Have a nice time.